Welcome to our educational journey into the essence of nursing care. Today, we embark on a comprehensive exploration of nursing's crucial role within the healthcare landscape, uniquely intertwining both art and science. This introduction sheds light on the vital nature of nursing care, setting the stage for an understanding of effective concepts and techniques. We will discuss best practices honed through medical progress and compassionate care. And as the video progresses, anticipate in depth discussions on nursing techniques, patient care, and the nuances of nurse patient interactions. Each step we take together strengthens the foundation of quality nursing care, leading to improved patient outcomes and a more enriching practice for nurses. Diving deeper into the art and science of nursing care, we transition from foundational principles to the core of our series, nursing techniques. This segment connects theory with practice, highlighting our dedication to ongoing learning and excellence. We start with basic nursing skills, crucial for every nurse's proficiency, where empathy meets precision in daily tasks like monitoring vital signs and dressing wounds. Then we elevate to advanced techniques, increasing in complexity and demanding a profound understanding of patient care's nuances. These advanced procedures underscore the significant impact skilled nursing care has on patient recovery and comfort, reflecting the deep connection between knowledge, intuition, and critical thinking. As we move ahead, these fundamental skills will paint a comprehensive picture of holistic patient care, underlining empathy, effective communication, and adept physical care techniques, guiding us towards the next stage of our journey, patient care. At the core of nursing lies a deep understanding of true care, which leads us into Module 2, Patient Care. This module delves into nursing's heart, transcending medical treatment, to explore empathy, communication, and physical care as pivotal elements. Through actions rooted in empathy, like holding a hand or offering a comforting smile, nurses create meaningful connections, sharing in the healing journey. Effective communication, intertwined with empathy, bridges understanding and action, ensuring a nurturing environment that supports patient recovery. Moreover, our expertise in physical care techniques demonstrates compassion in every gesture, embodying the spirit of nursing dedication. This journey invites us to view care through the patient's perspective, addressing their comprehensive needs and fostering a healing path grounded in care, compassion, and commitment. As we proceed, these principles will illustrate their importance not only in patient care, but in defining the nursing ethos itself. In the realm where compassion and skill converge, nurses emerge as pillars of patient wellness. Module 3 explores the essential healthcare best practices, emphasizing the nurse's role in ensuring safety and ethical integrity. Adhering to safety protocols transcends mere procedural compliance. It embodies a dedication to protecting patient welfare at every turn. Ethical considerations are navigated with a steadfast moral compass, reinforcing trust and respect in the caregiver-patient relationship. This segment also celebrates nurses' commitment to continuous learning, essential for delivering cutting-edge, personalized care. As we transition to our next module, we carry with us the principles of safety, ethics, and continuous improvement, pillars that fortify the foundation of nursing excellence and pave the way for a brighter healthcare future. Continuing our journey, we delve into the vital aspect of healthcare, the art and science of nurse-patient interaction. Effective healthcare builds on the strength of the connection between nurses and their patients, a relationship pivotal to recovery and satisfaction. Cultivating trust involves consistent, empathetic communication and a profound understanding of patient needs. Establishing a safe and valued therapeutic environment. This segment explores strategies to deepen this trust, emphasizing active listening, patient feeling validation, and addressing concerns with compassion. Masterful communication extends beyond words to include meaningful body language and accessible information sharing, empowering patients as partners in their care. Recognizing the broader spectrum of patient needs, emotional, psychological, and social, nurses adopt a holistic approach to tailor care plans effectively. Moving forward, we'll see how these interaction principles not only enhance patient care, but also significantly improve healthcare outcomes.